Hello there. My name is Bethany. I see your therapist recommended you to see me. Based on your referral and your questionnaire, it seems like you've been having some trouble sleeping and an increase in anxiety that started to impact your day to day life and your relationship with your wife. Does that seem correct?
Yes, my therapist said that you may be able to help me.
Would you mind telling me what's going on?
I just can't seem to go to sleep. My mind races and I end up tossing and turning all night without relief. And then in the daytime, I stay nervous and worry and worry all day.
Is there anything in particular on your mind or that's bothering you and keeping you worrying?
Everything. Just everything. I constantly worry about even the smallest things. Between all the worry and not being able to sleep, I have had no energy and have been so fatigued that nothing gets done. My wife has even noticed, and it has caused several arguments with her, and she is not happy.
I'm so sorry to hear that you're going through all of this. Is it okay if I ask you a few more questions?
Sure.
Is there anything else you do to cope with these symptoms?
Not really. I go to therapy. I thought about drinking to try and knock myself out, but didn't want to get hooked on drinking. My buddy said smoking might help, but I don't like being around smokers.
So you don't drink and you don't smoke. Are there any other symptoms you've noticed?
I've just been irritable all the time. But besides that, no other symptoms. I haven't been depressed at all.
Sounds to me like you're experiencing fatigue, a lack of energy, irritability, anxiety, and an inability to sleep. These symptoms sound very distressing. I'm so happy you came to try and get some help for these symptoms. I would like to help you find some relief if that's okay. Have you considered taking medications or have you taken any medications in the past that helped?
Absolutely not. I don't want to be stuck on a medication for my whole life. I'd rather just deal with my problems so that I can get back to my normal life.
It sounds like you'd rather work through whatever is going on instead of using medications because you're fearful of being on medicines for the rest of your life. Would you mind if I talk to you about your avoidance of medications? Because I would like to help you get back to a normal life and routine.
I guess I'm open to hearing what you have to say.
Okay, could you explain to me like what your aversion to medication is so I can better understand where you're coming from?
I don't want to be tired and sleeping all the time like a zombie. I heard that medications can be so sedating.
Well, while some medications can cause excessive sleepiness, not all do. Some sleep medications can be taken as needed and are not considered sedatives.
Well, I also don't want to be addicted, and I can't afford a bunch of medications right now.
I understand your fear of being addicted, which is normal, and a lot of people have that. But most medications are not addictive, and we can avoid the ones that are addictive if that's what you're looking to avoid. Some medications can be taken as needed for sleep, and you wouldn't have to take every day.
But what about the cost? I still can't afford an expensive medication right now.
That's completely understandable. Many of the medications I would consider for you are covered in some part, if not all, by insurance. If that's not the case, we could always use a prescription saving card.
I still don't understand why medications are so important.
Medications for anxiety and sleep can really help you return to your daily life. The sleep medication I would like to talk about could help calm your anxieties at night and help you sleep, which would hopefully relieve your secondary symptoms that you're experiencing related to the lack of sleep. Relieving those symptoms could then help you be able to be more awake during the day to complete the tasks that you're unable to do right now, which may prevent your arguments with your wife. So it would improve both your work and your personal life.
Okay. I guess I'll hear about the medications, but that doesn't mean I'm saying yes to taking it.
That's awesome that you're open to hearing about the medication. If it's okay with you, I would like to prescribe trazodone 50 milligrams at night for sleep. Would you like to hear more about that medication?
What is trazodone?
Trazodone is considered an antidepressant, but it's beneficial for anxiety, depression, and usually helps people with sleep. It can help you with your anxious thoughts, and it helps with the sleeping.
What about side effects? I heard medications can have a ton of side effects.
Well, that's true. Some do have side effects. The most common one for trazodone is usually related to the GI tract, and it usually can subside within a couple weeks. It's usually like nausea, an upset stomach, diarrhea. With most antidepressants, it does have a risk of causing some suicidal thoughts. If that were the case, I'd have you contact me right away. The only other important thing to note about trazodone would be to avoid any heavy machinery when taking it, because it causes sleepiness and drowsiness, so you can fall asleep.
How long does it take to work?
It usually takes about 2 to 4 weeks to start taking effect. It can take maybe up to about 8 weeks to have full effect.
Would I have to take it every day or multiple times a day?
I would recommend you take, well, it's taken at night, but I would recommend taking it every night when you start it, because you are having such anxious thoughts at night, so you can get the relief of symptoms. Once you start to have relief, or if you resolve your anxious thoughts, you may just have to take it every couple nights or when needed.
Will I have to take it forever?
With the addition of the therapy that you're doing currently to work on your anxieties, once you work through those with therapy, you may be able to just take the medicine as needed, or you may be able to just stop taking the medication altogether.
What if I end up too sleepy and feel like a zombie?
If that were the case, we could always decrease it to 25 milligrams at night instead of the 50 milligrams. And if it's still causing you drowsiness, or if it's excessive, we could always change to another medication if you'd like.
Okay, let's make a plan.
If you agree with the trazodone, you'd begin taking it tonight after you fill it, and then you would take it each night after, and it's usually right before you go to bed.
Okay, I think I can try this, but only if I can see you in a couple of weeks.
That's awesome, and that's great. I'm happy you're taking a step in the direction to finding you some relief. We can always meet up in 2 weeks. I have several availabilities in 2 weeks. You can schedule with the receptionist on your way out. If you have any of those symptoms or any other symptoms that seem to be distressing you, feel free to call us immediately. If you do have suicidal thoughts, ideation, or start feeling depressed since you aren't depressed, then I would call immediately and stop taking the medication, and we'll change it to something else.
Okay, thank you so much.